not a contour tourniquet, these things can really up the pressure, then that's very easy for me to say that 168 is 80% of my LOP and 174, man, that's getting close to my 100% occlusion, right? If I'm applying this to an older person, or if I'm applying this in a clinic setting, somebody who just had a surgery, who was recently on clot thinners or blood thinners, man, there's a lot of risk with it, and that's why I want to use a medical device, right? Medical device within a medical environment, because I am a medical provider, okay? If I do this stuff right, then I can regulate that system in real time and stick within that target zone. And I also have a clock. I know how long I'm doing this for. All that stuff's super important so that I get to this scenario here. Now this scenario is super important when we're talking about endurance and we're talking about strength, because one really crazy thing we see with BFR is that we've already seen that we're going to see some improvements happen. Let me find a napkin, guys. I left my napkin somewhere. Let me see. The live feed keeps breaking up. Shite. All right, well, hopefully it'll put it on YouTube. Okay, so what we're looking for here with BFR is something really, really neat, all right? So when individuals perform blood flow restriction, we're gonna see some really cool stuff happen that we don't see happen really anywhere else, okay? So number one, we're seeing that they're having improved adaptations to VO2. What is VO2? Well, at one level, it's the delivery, heart rate, getting the heart strong. Second level, it's compliance of the arterial system. Third level, it's the actual uptake of that nutrition in the limb. And when we're delivering VO2, when we're talking about VO2 max, we're talking about O2. So what do we know about O2 in the legs? We know that O2 plus glucose, right? Or let's say O2 plus pyruvate, right? I take these two suckers and I jam them into something called a mitochondria, right? The electron transport chain, and I get a bunch of ATP. So VO2 is reliant upon mitochondria, right? Because if I can deliver the oxygen and I've got the pyruvate, I can make this happen. But what happens with BFR, right? The O2 gets cut out. So the body then sticks within the anaerobic system, but what happens in anaerobic metabolism to muscle, right? Muscle increases in hypertrophy. And it's not just hypertrophy of contractile tissues, it's hypertrophy also of regulatory protein structures, like titin, right? Myomesin. And what lives in this regulatory stuff? Mitochondria. So BFR inadvertently improves VO2 max via increasing hypertrophy, allowing you to have more mitochondria, which allows you to undergo longer periods of aerobic metabolism, although you may be in a more demanding task like running or sprinting, which is really cool. Now, the other thing happens with BFR that we've seen is we have an increase in strength. And remember the strength part, man, it's bad. I went to sleep late last night, guys, doing stuff for my business. So, if I increase in strength now, dude, look at what I just did. I got a bump on VO2, increased some muscle size, and I improved in strength. Atop that, I probably did also increasing things like growth hormone, IGF-1, down-regulated things like TGF-beta, and myostatin, and that hypertrophy was a product of mTORC, right? So there's all this awesome stuff that happens. The cool thing is that I don't have to just be lifting weight. Lifting weight makes this stuff happen way faster with BFR. Why? Because the activities are more demanding, hence I'm able to recruit more fast twitch motor units, right? So strength is usually a strength activity plus BFR. I'm gonna get all of this stuff over here, right? I'm gonna say that's like the big old plus. But if I did an endurance task, let's just say something typical like what's been done in the past with walking and riding a bike, I get some benefit. I can see that I'm gonna get some improvements in strength, crazy enough, from walking, from riding a bike. I am gonna produce some lactate, which helps to drive some growth hormone and as well IGF-1 systemically. We would say that we are gonna get some reduction in myostatin, which will knock out TGF-beta, the scar tissue pathway, simply because we see mTORC is turning on. But we get some cool VO2 stuff happening as well. Now, if I didn't do any of this stuff and I just did something like a standard cell swell, which is just laying down and inflating the tourniquets, I don't get as much benefit. So we can see here that we're really kind of setting this up that we want in a clinical environment to provide a medical device, and we really want to try to be focusing on strength, because strength improves endurance as well, more so than just the endurance task. So in many cases, as what's said with one of my good buddies, another clinical instructor in Owens Recovery Sciences, that every day is leg day, right? So we can get all this cool stuff to happen. Now, the endurance studies of people walking, people jumping on a bike, there's a lot of benefit from that. And in many cases, in the elderly community, or even in a case where we have limited loading on a limb itself, meaning that person is not full weight bearing, they're recovering from a fracture, or maybe they're recovering from a chondral repair or microfracture, they can still get some really good benefits from being on something like an Ultra G or a standard Aerodyne bike. And as well, somebody can still gain some benefits, not as much with something like cell swelling, but it's a start because we can at least decrease atrophy or at least attenuate some atrophy effects. Now, endurance tasks can vary, right? So I'll end off on this note. There's lots of good literature out there showing that endurance tasks can essentially be done for time. They typically go anywhere from, at the lowest level, 2 minutes, which is typically, it's done at higher power outputs, to as long as about 15 minutes with much lower output. So we would say increased power output, right? Wattage. This usually is decreased low power output. And that's where it could also be done specifically on just wattage, just power. Okay, I want to see what your power output is and take a percentage of that. If we look at the time ones, this is pretty cool. So we know that in order to improve VO2 max, kind of the normal studies show us that typically the higher we go, right? So let's maybe start here, 60% VO2, here we have 80% VO2. So we know that at 80%, you really can't hang out there that long. You may be at that for, I don't know, maybe 2 minutes. And at 60%, you can kind of hang out there a little longer, right? You can maybe be at 60 and even 40% VO2 max for, anywhere like maybe 30, maybe 45 minutes, okay? But typically it takes a long time to make these actual adaptations occur. When we look at BFR, we're seeing that these positive VO2 changes, in the ballpark of like 12% improvements, we're seeing with people riding at like 30% of their VO2 for like 15 minutes, right? Or we do have some groups that are even doing 40%, so even lower. Same thing at like 15 minutes. 30 is probably gonna be closer to like 20. But we see these groups that are performing at these super low levels are getting similar heart rates as compared to other groups that are pedaling at 80%. Now why is that? Well, what do we say? We said that heart rate times stroke volume equals cardiac output. We know stroke volume drops with BFR, so heart rate goes up, so they're working in a really higher heart rate intensity zone, maybe let's say between 60, right, 68. So they're getting improvements in heart rate, improvements in muscle hypertrophy, which indirectly supports more VO2 by having just more mitochondrial density to uptake more oxygen, can undergo more aerobic respiration through the Krebs cycle. But they're also getting benefits in strength, which we can see also have a relationship to power production. We can also see has a relationship to time to fatigue, or their little bugs, sorry guys, their lactate threshold, and as well seeing improvements in their 1 minute mile time. So there's a couple protocols that I've put together that come from research that I use with a professional sports team here in Tennessee, and having just really awesome results with it. Let me check if there's any questions that you guys have posted. No questions. So that gets us to the topic for today. So BFR and endurance. Again, to kind of like highlight, we know that when we drop stroke volume, heart rate goes up, TPA goes up. That's a way that our body protects ourselves from forming clots. It's super important that we do use a medical device when applying this in a treatment setting because of the risk that we run to the dynamics of the body. Okay, can't keep playing around with old data showing that wrapping a knee wrap is sufficient to do this work. It's not. Okay, and if you are a medical provider and this is what you're doing, you've got a lawsuit on your hands waiting to happen. And I mean that in the utmost respect to you. Why put yourself in liability? Why put yourself at risk? Why put your patient at risk? Remember, what's the first Hippocratic oath? Do no harm. Okay, do no harm. That means you're going to do the right thing. And whether that means you're going to spend a little bit of money to buy a medical device to do this because you're in a practice setting, you're applying this to a post-op patient, that is, you're going to gain so much more business doing this right, marketing that correctly, than you are if you're not. And it takes one person to sue you, and you're out. And that's coming in the corner, man. We've got that coming around, man. We've got big people in the physical therapy industry worldwide talking about the standardization of BFR, or why we need to apply a medical device. So I implore you, really be considerate to what you're doing to yourself, but more so to what you're doing to your patients, because that's your business. If this isn't your practice, and you work for somebody else and you work in a corporate setting, right, and you're just doing it because you think it's cool, man, that's on you, okay? If you own your own practice like I do, every single penny that I put into this business is to give the highest value, the highest level of quality care to my patients. Because I know this stuff makes a big difference. And I'm not going to play around with that just because BFR is cool and I want to jump on the bandwagon. Okay? So you have to really be cognizant of that, guys. Again, here's our review for the day. I'm going to take some questions for the next like 5 minutes, and then I got to bug out, guys. So I'm going to flip the camera around. You get to be on me and get to see the rest of my little space back here. So talk to me, guys. Questions. Any of you are runners? Any of you are cyclists? I do a lot of work with individuals that are in all aspects of that, and we use BFR as part of their programming. Same thing with weightlifters or CrossFitters. I use it, it makes up such a big bulk of my rehab with them. And this could easily be, hey man, I pulled my hamstring, I hurt my back, I've got to take some time off. Sweet, this is the optimal time, right? If you are an athlete or you work with athletes, don't treat them like couch potatoes. Sure, people need downtime, but what do they really need more than anything? They need an avenue to regenerate tissue. They need an avenue to start healing. All right, and what do we know exercise does? Exercise can help to heal, but comes with comes with a risk that we need to mitigate, which we can do with BFR. So, all right, you guys got me for another 4 minutes. Don't be afraid to ask. I don't think any question is a dumb question. Okay, I'm here to supply education to you. That's why I do these. So why don't we do this? Why don't you guys tell me what you want me to talk about next? Are you aware of any papers that have looked into the effects above the cuff? Sure. So there's papers that show improvements in proximal muscle adaptation. That show positive signs of muscle recruitment, improvements in strength, specifically if we're performing squats, how it improves the glute. And the same can be seen with the upper body, where we see positive signs of increased hypertrophy of the pec and so forth. So some of that stuff is localized, some of that stuff is more systemic in nature, meaning it's more hormones involved that allow the body to heal faster. So that although I did BFR on my legs, it'll probably help out somewhere else. So, and some of those studies, I think probably Yasuda or Takarada have probably done those. Memory serves me right. All right, guys, you got me on for another 2 minutes. I'm gonna walk away for a second. I'm gonna get some water. You guys will come along for the ride. Fitness pain-free. Hey. All right, any questions, guys? Because the live feed's about to come down in a minute. So, if any of you are interested, any of you are clinical providers, you want to learn more about BFR, how I apply it, obviously stay tuned to the live feed. I'll always post when I'm going to do one, because there may be some days that I can't do them back to back just because I'm busy here in the clinic or in the gym. But if there is a big interest to want to learn more, to get certified, please direct message me. I will be more than happy to help set you up with appropriate channels. And mind you, anytime that I and my company and the company that I work with, Owens Recovery Science, when we set up people to do these courses, we really heavily help out with the marketing, just because of the amount of network connections we have within the professional world, in sport, within the division world, and professional. I don't just mean traditional sport like football, baseball, basketball, soccer, because if you check out our company that I work with, their site, owensrecoveryscience.com. You go to search for a certified provider, you're going to see all the teams that we work with. So again, the reasons why we work with them is because, again, we're providing a medical device that can be used within a clinical setting that is being monitored by a clinical provider. Okay, so reach out, let me know. If there's any topics, just DM me if there's a specific topic you want me to highlight on, but I'll do my best to get these all on YouTube. in the appropriate time, and I obviously edit out all this other stuff at the end. So, all right, guys, without further ado, I got to bug out. I'm going to get some training in myself. See you later.